really during a time when you feel like maybe your body has kind of failed you, you can have your body work for you. I'm Dr. Kari Adamson, one of the plastic surgeons with BayCare Plastic Surgery. A DIEP flap is a type of breast reconstruction for patients who have had mastectomies. And we use the belly tissue that normally we would throw away in a tummy tuck. Sometimes it's not exactly the same incision as a tummy tuck, but we use that tissue to build a breast. And it involves taking the blood vessels from the abdomen and connecting to blood vessels in the chest. And it's pretty cool. We use a microscope. We connect the vessels with suture that's about as thick as a hair. And it's like a transplant to yourself. The benefits of having a DIEP flap compared to implant-based reconstruction include you don't need imaging down the road to look for rupture like you would with an implant. It's often a more natural look and feel, especially for certain body types. For some patients, getting rid of that extra belly skin and fat is an advantage. And for a lot of patients, just having a natural reconstruction is also important. Doing a one-sided DIEP flap takes on average 4 to 5 hours, and doing both sides takes about 6 to 8 hours. Sometimes faster, sometimes not. Usually we are within those time frames. It is safe to have a surgery that's that long. We do what we can to keep things moving. So in our practice, we always have 2 surgeons. We usually have 2 PAs to keep making progress. But we have awesome anesthesiologists who are board certified, keeping you safe. Patients do really well even with that length of surgery. So patients are admitted after surgery for 2 nights usually. Once in a while, patients will stay an extra night if they need to. Patients tell me that they love our nursing staff, and our nurses tell us that they love our patients. You know, we love them too, obviously. So the patients are checked on very frequently that first day. They get up and walking that first morning after surgery, eating regular food. They are just kind of building confidence then after that, and usually ready to go home by 2 days after. DIEP flap surgery is a painful surgery. Most patients tolerate it really well. Everyone's different, you know, but we do a whole enhanced recovery after surgery protocol. So you actually get your first pain medications right before surgery. Then during surgery, you're getting pain medications, and we also inject a long-acting numbing medication that lasts for 3 days. And after surgery, you get a whole range of different medications. So we give you a nerve pain type of medication, Tylenol, a medication through your IV that's kind of like ibuprofen, and an opioid. So you kind of get a bunch of different meds that minimizes the amount of actual narcotic you need. With that all being said, most patients are off of their opioid or narcotic pain medication within a few days after surgery, and definitely by a week after surgery. Recovery after a DIEP flap, that first week or 2 is pretty tough. You'll definitely want some help. After that, I think it's mostly being kind of sore, getting stiff just from the positioning. By about 4 weeks, patients are feeling better, but pretty tired yet. And at 6 weeks, we have no further restrictions. We also do send all patients to physical therapy about 4 weeks post-op to start improving the range of motion and start strengthening as we get further out. So 6 weeks of restrictions, but a couple months before you're really feeling back to normal. Our care team is amazing. We have all of our plastic surgeons are involved in DIEP flaps. All of our PAs are involved as well. Our nurses are trained in taking care of patients who've had DIEP flaps. You'll encounter everyone in our clinic basically. Also in the hospital, we've really specially trained our nurses that are in the ICU, our OR nurses, the anesthesia team, anesthesiologists and CRNAs. Because we do these regularly, everyone's very familiar with what a DIEP flap is, you know, what these patients are going through and how to take care of them. So I love our care team. I think that's our biggest asset. The wait list is always in flux. And, you know, that's sometimes the first questions I hear from patients during a consult is, how long do I have to wait for my DIEP flap? Depends is the short answer. We are doing usually 5 to 8 of these a month at this point, and we're just limited by OR time and getting 2 surgeons in the room together all day. So, while the wait may be several months or even longer, depending on variables and kind of changes in the schedule, sometimes it may be sooner than that. But, it's not a quick answer, that's for sure, to get a DIEP flap, but it is well worth it. So I'd say if you're thinking about it, I'd recommend coming in for a consult sooner so we can move forward. I think that at BayCare, we have a really comprehensive team and plan for your DIEP flap surgery. All of the surgeons are very involved. You see your surgeon, before surgery. You see RPAs who you'll be very familiar with, and the surgeons after surgery in the hospital, in the clinic. So you're going to be seeing the same familiar faces regularly. I think that we are well supported by the hospital. So we have the latest and greatest equipment to use cutting edge techniques. We are very involved with staying up to date at national meetings. We want to really give the best looking result and the most functional result. So I think that, having a team that's energetic, passionate, empathetic, those are all some of the qualities that we strive to give you. I love, working with breast cancer patients and patients who have had mastectomies. I like doing all kinds of reconstruction. But for me, what's pretty cool about the DIEP flap is that it's a way that you can take your own tissue, detach it from the body, and then bring it back to life. And really, during a time when you feel like maybe your body has kind of failed you, you can have your body work for you. So I just think it's a really cool procedure, and I'm happy to be able to do it.